Good evening. I am Dr. Sayantan Banerjee. I am currently practicing in Belgorия, North Kolkata. So today I will try to share some of the experience regarding gastrointestinal diseases of my patients. Commonly, gastrointestinal diseases are nowadays are on rising throughout the country, and probably in Bengalis in our part of the state there are a bit more because of the fact due to the probably the oily foods, due to the food habits, due to our lifestyle. Several factors are there. So today I will try to highlight on some of the cardinal symptoms or the common symptoms of the gastrointestinal problems that occur to my patients, and try to focus on its association with other diseases, particularly diabetes, sometimes thyroid disease, sometimes I will come to that later on one by one. So first of all, what are the common symptoms that we have in patients of gastrointestinal symptoms? The first of all is there is a bloating, there may be some nausea, there may be vomiting, and flatulence are there. Sometimes patients complain of there may be some certain constipations. Sometimes there are features of altered bowel habit, mucus secretions, diarrhea. So one by one, I will come to these factors. So let's start with the first, the most problem is the reflux. The reflux is very common. This occurs due to our lifestyle, due to our food habit. So it's better to modify our lifestyle. It's better to take not full stomach meal. It is also good for to control your blood sugar and also to control your flatulence, particularly patients having hiatus hernia or reflux esophagitis type of disease. They should be advised to take frequent small meals, and it is better not to take water alongside the food, because due to the density problem, the amount of oil that will float inside the water, and that will cause the bloating and belching and this type of problems. Better to not to lie down after taking a meal. So frequent small meals are always advisable. That will also help in your controlling your blood sugar, as well as it will reduce the symptoms also of belching as well as reflux. Reflux esophagitis or the reflux disease also can causes serious problems. For example, reflux can lead to infestation of interstitial lung disease, which will be not that common but not that rare also. These patients, they if they have micro aspirations of gastric content, which is toxic acidic content, they can lead to problems like increasing in the fibrosis and inflammation of the lung. So indirectly, this small reflux can cause damage to the lung also. Reflux can lead to other serious consequences. For example, reflux of food in patients which were relatively comatose or relatively unconscious can lead to severe aspiration pneumonia even. Going to the other parts of the disease like dyspepsia, pain, sometime a long-term anti-proton pump inhibitors are required. Sometimes we give antihistaminics, sometimes in combinations. In those cases, sometimes it has been seen adding a prokinetic like domperidone sometimes help in particularly in that will decrease the stomach transit time and help in digestion. Particularly regarding the we can give in case of duodenal ulcer or gastric ulcer, we prefer 4 to 8 weeks of proton pump inhibitors. Sometimes the gastritis or the duodenitis that without can occur without a bit as high acid secretion, that occurs due to a particular bacteria called Helicobacter pylori. An Australian doctor has got a Nobel Prize for that after proving that a bacteria called Helicobacter pylori that causes serious gastric ulcer, which sometimes may lead to gastric cancer. So a long-term dyspepsia patients often need to do some endoscopy and do RUT test and other tests to look for any evidence of Helicobacter pylori. There are 2 weeks of antibiotic course along with the proton pump inhibitors that we can give to eradicate that bacteria. Otherwise, long-standing bacterial infection may land into even cancer of stomach as well as of the duodenum. So these are in problems of regarding the ulceration. Going to the other part, constipation is nowadays a very important issue, even in childs, even in adult, due to our food habits. So first of all, its lifestyle modification is most important. Regarding the lifestyle, the most important part is take adequate amount of water. If you are not a kidney or a heart patient, adequate water and adequate fiber intake can ensure the proper movement of the gut. The movement of the gut in a rhythmic peristaltic manner is very much essential for a proper bowel movement, which is often cannot happen in patients of nerve disease having autonomic neuropathy. Just also seen in patients of long-term diabetes, thyroid patients. So these patients often land in problems of stool problem in stool clearance. It can be also very disastrous in patients having respiratory problem or heart problem, because whenever there is a collection of feces as well as flatus inside the abdomen, what happens is the diaphragm gets upward movement of the diaphragm, and this diaphragm will prevent the lung from free movement. That's why we have often seen patients of COVID positive pneumonia in the COVID days who are on 1 liter of oxygen and was relatively better in the morning, but after taking the lunch, the patient has a requirement of oxygen of 5 liters. This is due to the fact that small amount of food that goes inside the abdomen, and if there is already constipation, so that will increase the height of the diaphragm, and that will cause the difficulty in movement of the lung, and thereby causing the increase in the oxygen demand. So it is very important for the gut clearance. There are so many molecules we can give for the gut clearance. For example, there are lactulose solutions, there are lactofibers are there, and polyethylene glycols are there, which are inert molecule and that helps in clearance of the gut. Prucalopride, a newer molecule, has been given, which can help in the proper movement of the gut. So this is a very essential gut movement, because gut movement, if not done properly, because that can also invite secondary bacterial infection, and that can be lead to severe gastroenteritis. Going to the other spectrum, now constipation is also a serious phenomenon seen in patients of diabetes as well as thyroid patients. So diabetes and thyroid disease has to be corrected to cure the constipation also. Now, on the other spectrum of constipation, there is diarrhea. So diarrhea can be acute, can be subacute or chronic. So acute diarrhea, that can be due to the infections due to ingestion of toxic substances, that is quite curable by antibiotics. The problem occurs when the diarrhea is a recurrent and chronic one. In that cases, there are some other disease which we have to take into account. Particularly, there are inflammatory bowel disease and irritable bowel syndrome. Gut movement has also a relation with anxiety. Anxious patients often have a high propensity to go for stool. There is a certain relation of psychiatric problems with the gut movement. So diarrhea, if it is irritable bowel syndrome, there are drugs like rifaximin, probiotics, as well as mebeverine. They do proper well in the management of the irritable bowel syndrome, particularly the diarrhea types. But the problem is, if you are a suspected case of irritable bowel syndrome, but say 2 to 3 months we have on treatment, but the patient is not getting better, so you have to go for camera test, that is the colonoscopy and ileoscopy, to look for if there is any active infection or inflammation inside the gut, which is called the inflammatory bowel disease, like Crohn's disease, like ulcerative colitis. Now, these are disease which needs to be get attention, because from this there may be serious problems that can occur, like fistula, like rupture, perforation, even cancer. So long-standing diarrhea, we have to look for the cause, and a colonoscopy is necessary at that particular point. Otherwise, treatment of irritable bowel syndrome is commonly what we give, but we have to check on the colonoscopy report before declaring a patient of irritable bowel syndrome other than inflammatory bowel disease. So these are the factors commonly we encounter in gut-related problems. But in the gastrointestinal system, we also have a very important part of the glands, particularly the liver, the gallbladder, the pancreas. So they has to be also taken into account. A good liver is very important for our health overall. So, but fatty liver disease, even alcoholic and non-alcoholic fatty liver disease is on a very high rise, particularly due to our lifestyle. like high cholesterol, high sugar. This is causing the problem of non-alcoholic fatty liver to rise. So there are treatments, there are certain saroglitazars, there are vitamin E, there is pioglitazone. So sometimes we advise them to do a fibro scan of liver to know there are certain tools we have. So we have to correct those things because fatty liver, long standing, say around 10 years, if it is a fatty liver, that can, even without a drop of alcohol, can lead to cirrhosis of our chronic liver disease. So we have to be careful. And particularly in patients, obese patient, diabetes patient, they often land in problems of fatty liver disease. So a periodic blood check and sometimes ultrasound and even fibroscan of liver we can do to understand the condition of the liver, which is very much important for our well-being. A gallbladder disease is also a known fact. It is commonly high fat intake. Young females are 40 years, females are commonly affected. Regarding the health of the pancreas, which is also necessary for our health, alcohol restriction is very much important. Even smoking can lead to pancreatitis. So lifestyle modification is very much necessary. Controlling certain sugar tablets can lead to pancreatitis. We have to be careful about that, the doctors. So in a nutshell, you should have a good gut as well as a good glands like the liver and the pancreas to have a good digestion. So my friends, it's time to check all those things when a patient comes for a regular visit. And it is not, it is very important to take the patient's problem like dyspepsia, like reflux or constipation in a serious note, because that may land into serious trouble in few months. Thank you for listening to this small video. And I think it will be helpful for all of you. Good night.